Hi, I'm Andy Kerwin, and I just want to talk to you a little bit about our study that we did for the CLOTT study group. The CLOTT is an acronym for the Consortium of Leaders of the Study of Traumatic Thromboembolism. This is a study of a group of 17 centers across the country, level 1 trauma centers, that had an interest in traumatic thromboembolism and how that was managed. It was a prospective observational multi-center trial looking at patients that were aged 18 to 40. And the reason for that was because of the funding through the Department of Defense. Wanted to make sure it was young patients who could be deployed. We looked at patients that had high risks for developing VTE after a major trauma. We wanted to specifically look at the use of prophylactic inferior vena cava filters and whether we were following guidelines that have been put out by national societies regarding the use of prophylactic IVC filters. What we found that there was a wide variability in the use of prophylactic IVC filters. Only 74 patients had prophylactic IVC filters inserted. And the study group was almost 8,000 patients. The most common indications that one was inserted was for multiple repeat trips to the operating room or for neurosurgical trauma. The mean time to insertion was 7.2 days. The mean time to initiation of chemical VTE prophylaxis was just under 5 days at 4.8 days. IVC filters most commonly inserted by interventional radiologists, vascular surgeons, and then trauma surgeons. So I think the important findings that we found from this study is that there's still high variability in the use of IVC filters despite guidelines from national societies describing when they should be used. And I think that trauma surgeons can use this study to take to their centers and see are they following current guidelines for the insertion of prophylactic IVC filters. Some indications could be if there was an absolute contraindication to chemical prophylaxis or repeat trips to the operating room for procedures to be done.